everyone for joining. I'm really looking forward to discussing this report, as well as the assessment process and what the broad implications might be for our own community. I also want to acknowledge the contributions of some wonderful colleagues who are also involved in leadership roles in the report, including David Nicholas and Grant Bruno, who are also online. So I'll just start with an important land acknowledgement. Edmonton is located within Treaty 6 territory and within the Métis homelands and Métis Nation of Alberta Region 4. We acknowledge this land as the traditional territories of many First Nations, and broadly that we are all situated within the traditional territory of First Nation, Inuit, and Métis people from coast to coast to coast. It's important to recognize the unique and enduring relationship that exists between Indigenous peoples and their traditional territories. And as we gather on these ancestral grounds, important to honor with deep gratitude the land itself and the people who have stewarded it through generations. And in particular, when we're considering any healthcare need and any broad societal need, it is important to consider the unique experiences and needs of First Nations, Inuit, and Métis people. So the broad objectives for the presentation today are just to give you a sense of what this assessment and report is all about, the how and why of how it came to be, and a bit of a summary of its key findings. A smaller group of us got together last week for Autism Journal Club, which is offered through the Glenrose, and it was really great having your comments and impressions around what a report like this means in your practice and in looking towards the future. In a report like this that covers such a breadth of issues and the needs of such a breadth of people with lived experience, it is also an important opportunity to reflect on important differences in perspectives among the stakeholder community, among autistic adults, among autistic youth, and among parents and other family members. And to really bring this report to life, to think about what this means nationally, but also locally. So in particular, to consider how the key findings, which we'll speak about, are applicable and can potentially be addressed within our local support and service systems, and more broadly within the province, and how we can be working together in our various roles to advance these important issues. So just a little bit of background. So the Canadian Academy of Health Sciences was the organization that was responsible for this assessment. This is an arm's length kind of academic organization whose membership is comprised of over 850 Canadian health sciences who are essentially nominated by their respective universities, institutions to become members. One of their key functions is to conduct these kinds of assessments. So they're often contracted by the federal government to conduct literature reviews, to bring together diverse groups of scientists. In this case, in looking at autism-related issues, a much more diverse group of people, both with lived experience and professional backgrounds. And the intention is to provide unbiased, actionable key findings and strategies to address major challenges affecting Canadians, with a focus on health. Clearly, as the organization ventured into autism, the issues go way beyond health. If you're interested in examples of these reports, the website is listed here. The picture depicts the covers of a number of other previous reports. And the actual report that I'll be speaking about today was circulated with the invitation for the rounds, but is also available as well as kind of alternate forms, including a summary report and an easy read report on the Canadian Academy of Health Sciences website. I'd like to leave lots of time for discussion today. This report, as you can imagine, is a bit of a bear. It's about 400 pages in total length, about 260 pages of content. I'm probably a bit biased, but it's actually relatively readable and organized by the various sections that I'll talk about. But it's obviously a lot of content to try to distill into a brief presentation. So I will give a high-level overview of what was involved in the assessment and generating the report, some of the critical key findings, and then leave lots of time for discussion. as I mentioned, ultimately, this is a report which followed kind of a similar track as previous reports from the Canadian Academy of Health Sciences. It was requested by the federal government through the Public Health Agency of Canada. The federal government has expressed an interest in developing a national autism strategy. The Public Health Agency of Canada, to a large extent, set the framework in terms of the specific focus areas, and the methodology to some extent was negotiated up front, which provided some guidance, but also, I think, established some important kind of constraints and limitations, which I'll also speak about through the report. It was a partnership between people with lived experience and people with professional and academic backgrounds, and also the intersection of the two. It consisted of both an extensive literature review and also extensive stakeholder consultations, which really kind of grounded the evidence and addressed important gaps. And although it was requested by the federal government, the hope is that it was sufficiently comprehensive and relevant that it could provide guidance to decision makers at other levels, including the province, to service and health organizations such as ours, and to the private sector and to frontline people. I mean, it does address a breadth of issues. It provides some general evidence-based strategies, and it gives us some food for thought in terms of how we tackle some of these important issues. Broadly, this was an assessment that was rooted in co-development and collaboration. As I commented, there were some elements of it that were preset, including the specific content area, but there was some opportunity to establish a leadership group and a number of work groups, and largely these were co-led by people with professional backgrounds and also by people with lived experience, including autistic adults as well as parents of autistic individuals. There was also an effort to ensure that the leadership group reflected the diversity of Canadian society and valued and honored diverse forms of expertise. As I'll comment, there was a specific work group that delved into issues related to the Indigenous communities, but also significant limitations related to that effort. Up front, there was sensitivity to the vocabulary that we used, and from a very early stage through surveys of stakeholders, including people with lived experience, the leadership group landed on using identity first language. So that is, and you've probably noticed that I'm referring to autistic as opposed to someone with autism or someone on the spectrum. And I'll comment on that a bit further, but it really reflects the expressed preferences of adults on the spectrum in terms of their preferred respectful vocabulary. There was also sensitivity to issues of universal design and safety, but there were certainly some bumps along the way, particularly as we brought together groups of stakeholders in open dialogue, which I think really brought to the surface some of the tensions and differences of opinion, and just sort of the passion and urgency of some of these issues, which sometimes boils over and can create risky situation for people psychologically. And then ultimately an openness to multiple and evolving perspectives of autism. But as I'll comment, that there are some points of departure in these perspectives that we need to continue to grapple with. Just as a broad overview, I mean, this is a process that took place over about 19 months. There was a lot of work to be done, and we were fortunate to be supported by additional staff through the academy. So there was a project manager as well as some wonderful professional researchers and scientific writers that helped us kind of wade through the extensive literature. There was a review of Canadian policy documents as well as policy documents from other countries. In total, of over 6,500 research papers and reports. Obviously, some that we went into in greater depth, but this gives you a bit of a sense of sort of the depth of the review and also the breadth of issues. I'll give a bit of a summary in a moment, but there were over 5,500 stakeholder touch points. So that is, we heard in various ways from autistic people, family members, service providers, and other members of broader Canadian society to provide sort of that broad breadth of perspectives. There was a lot of meeting time. It's important to note that this was a project that was done in the midst of the pandemic. pandemic. I mean, clearly that had important constraints. And, you know, I'm very cognizant now as I kind of stare at sort of the mostly sort of blank screen in front of me and my slides. It's a little bit different than getting together and connecting with people and talking. There were also people in areas of the country who don't have stable internet, and that's not sort of it's not a random distribution. I mean, there are important communities and voices that experience barriers in terms of being able to contribute to a conversation this way. On the other hand, having the communication online certainly created some opportunities for people who would have had difficulty traveling long distances, or who would have preferred not being in a large room with lots of activity to have a chance to contribute. So I think, like everything that we're learning through the pandemic, I mean, there are some lessons to take away, but it's also important to be upfront about the constraints. I think it probably allowed this to be more of an incremental process. The Academy's previous assessments typically would involve like 3 or 4 meetings and then sort of lots of work in between, but we were able to meet in various forums a lot more frequently. And it also allowed for a more stepwise process of getting input from the broader community of stakeholders. So rather than just sort of a one-off question about perspectives, there was a chance to kind of hear people's perspectives, kind of shape some of our initial review and key findings, and then bring that back to people for feedback. And then there was also a process of external peer review, pretty extensive with 11. And as you could imagine, as there was an effort to choose across the continuum of expertise and needs, a lot of tensions even among the peer reviewers. A brief summary, but I want, in terms of sort of the number of people that participate in the stakeholder consultations, but just to acknowledge that you know, a significant percentage of these were at the level of a national survey, and a smaller but significant percentage was sort of more a substantial consultation through online forums, targeted conversations with people from particular equity-seeking groups, particular communities. It included a group of nonverbal autistic people who communicate through augmentative communication, which is a really important perspective to capture. And then there was a series of public forums as we started to have kind of draft key findings. So I'll kind of shift now to talking a little bit about the experience of the assessment and sort of how we approach this. So, I mean, first of all, we recognize that there are multiple perspectives that have to be considered, and sort of historically how these perspectives have shaped the questions people have asked and the data that's available to us. So, I mean, there's the traditional biomedical perspective that sort of situates autism as a medical diagnosis. It largely views disability as kind of inherent to some of those individuals' characteristics. And you know, and this is an important perspective in terms of considering health and mental health needs, and in particular considering sort of underlying biological issues. But clearly that there is an emerging and highly informative other way of thinking, and that is around autism as difference and diversity, and more broadly the social model of disability, which really situates autism as both a difference and a disability. To some extent, the disability may be related to characteristics of being autistic and some of the co-occurring health and mental health conditions, but it also reflects often the mismatch between the individual's needs and the environment, and in particular, the degree to which autistic people face a less inclusive society that doesn't necessarily accommodate or respect their differences or needs, and also reflects the needs to really think about sort of how do we create a Canadian society that allows autistic people to thrive without having to conform to sort of our artificial or arbitrary sense of kind of what kind of a neuronormative world is. So it's, you know, it's an encouraging perspective to take, but I will say that there are some important tensions that come to the surface as we think about sort of historical perspectives, kind of existing research data, and sort of this broader kind of neurodiversity perspective. And some important tensions that came to the surface fairly quickly were, how do we position early supports and services, and particularly interventions and around kind of behavioral interventions interventions, including ABA. On one side, there are many parents who are very concerned about the lack of access to early supports and services. There are provinces that sort of heavily endorse sort of a fairly traditional ABA early treatment model, where that was really sort of their primary kind of a priority for this assessment, and kind of looking for endorsement of kind of lifelong public funding for these types of interventions. On the other hand, there's a significant dialogue and community who really views early ABA as an affront to their identity, and a whole notion of using behavioral techniques to somehow treat the autism out of them. And I think that we were supported through the existing evidence base, which really kind of integrates the behavioral teaching methods, but really sort of frames them in terms of how children learn, and the possibility of incorporating effective teaching strategy into more of a naturalistic setting that respects individual and family needs, and incorporates learning opportunities into everyday activities. But this does create an important tension across those communities. In fact, even the word intervention was triggering for a number of the autistic adults that we spoke to. And even though we started with kind of the direction of Public Health Agency of Canada to talk about evidence-based interventions, we ultimately framed that whole area of the review as supports and services to kind of take a more neutral stance, and not kind of exclude a large segment of the stakeholders from that dialogue. Another major area that is a source of tension is how we frame high support needs. So on one hand, we respect the identity and autonomy of autistic adults who are participating in this process, and we continue to look at ways of eliminating barriers to participating in society, to contributing, to pursuing interests and passions. But at the same time, how do we create a framework that acknowledges that there are individuals on the spectrum who, in large part because of co-occurring intellectual disabilities as well as other developmental challenges, may remain highly supported on parents, other family members, other caregivers throughout their lifespan? And how do we talk respectfully about individual needs without leaving any individuals and families on that continuum feeling excluded from those from that conversation, or a sense that their needs are not being fully addressed? There's an interesting example from a recent effort, the Lancet Commission, which brought together probably more of a professional group, although there were some people with lived experience on that panel. Some of you are aware that they landed on a term and a concept of profound autism that sort of describes a subgroup of individuals on the spectrum who have these kinds of support needs throughout their lifespan. But the notion of a category that sort of characterizes people as being in that situation was deeply offensive to a number of autistic adults. And again, to avoid sort of categorizing or somehow suggesting that support needs are driven by one particular feature, because there's certainly many people whose mental health needs leaves them at high needs of support as well. But on the other hand, how do we avoid a situation where we're somehow understating the importance of addressing the needs of adults who have both autism as well as intellectual disability? The framing of financial issues and certainly the feedback we got was that some of the traditional ways of describing costs associated with autism, again, are very pejorative, because they somehow suggest that autistic people are a financial burden to their families and society. And how do we just ensure that we have an understanding both of the number of autistic individuals as well as sort of the breadth of the support needs, and make sure that those considerations are taken into account sort of when provincial and federal services and supports are taken into account. And then, of course, a broader dialogue around, do we need an autism strategy, or rather we really should we be taking a less categorical approach to be thinking about a needs-based approach across neurodiversity and neurodevelopmental differences and disabilities. And it's interesting that question, I think, really resonated not only with parents and service providers, but also with many autistic individuals themselves. All right, so next so after that pontificating, but I will say that these are important. These are not just theoretical issues. These issues have really important implications, both around how the evidence is framed and how we think about sort of a way forward that doesn't leave people feeling undervalued or excluded or invisible. How do we sort of, across the service continuum from frontline providers to national policy decision makers, how do we ensure that the needs across this continuum are met? So shifting gears now, I'll talk a little bit about the specific key findings of the assessment. So essentially, sort of what were the conclusions that we drew from both the literature review and the stakeholder consultation, and how and ultimately how to frame those in a way to point the way forward for policymakers. We did have kind of an important constraint that we were not allowed to make sort of concrete recommendations, that ultimately this assessment was not a policy document in itself, but rather a strategy that would guide policy. So we had to be kind of both sensitive and creative about framing the findings in a way that the way forward was quite clear, but it led to some indirect language. So the three broad thematic areas that were selected by the Public Health Agency of Canada were diagnosis, supports and services, economic inclusion, and social inclusion. We also recognize the importance of considering facets of identity and intersectionality, and the broad relevance of all of those issues to the needs and experiences of autistic people and families. And we also generated strategies kind of drawn from examples in both within Canada and in other areas of the world, like England and Australia, to really think about how one positions a research report like this to actually make a difference and lead to specific actions. So just kind of a brief overview. So in terms of intersectionality and diversity, we recognize that there are many aspects of people's identity as well as living circumstances that have a significant impact in terms of the reality of their day-to-day needs, how they experience the service system, and ultimately sort of what strategies are going to be needed. We also recognize that there are important and unique considerations for First Nations, Métis, and Inuit people, broadly referred to under Indigenous peoples, but there are risks of taking a homogenized approach, and clearly there are unique facets of identity and culture and needs across the Indigenous communities across Canada. I also want to acknowledge that ultimately this assessment process was not planned or resourced to be a needs assessment. That applies to the autistic people across the country, but it particularly applies to First Nations, Métis, and Inuit groups. And although we were really honored and blessed to have the opportunity to hear from people from First Nations and Métis community in terms of their experiences, sort of their insights about autism itself and how autistic people are gifts to their families and communities, and also sort of how a cultural approach leads to many positive experiences that lead to a sense of inclusion. Ultimately, this was a piece of the assessment that was not developed with Indigenous leadership, and it wasn't really constructed in a way to point a way forward. So in terms of these considerations, broadly considerations around multiple facets of identity are integrated through the report, but we also recognize that we really have not accomplished a goal of establishing sort of what the needs of Indigenous communities are, and really the key finding from that respect is that an Indigenous-led, culturally relevant, and really localized approaches that are grassroots, that involve the leadership and including the elders of the specific communities are really needed to develop kind of a community-led approach to addressing autism-related needs, and that there's a broader context of disparities in access to sort of basic life and developmental supports. Again, I feel very fortunate to that Grant Bruno is joining us today. Grant Bruno was part of that work group, shared a lot of insights and both to me personally in terms of sort of really understanding what's going to be needed in terms of moving this forward. And I certainly welcome Grant and others' comments about this piece of the assessment sort of as we move to the discussion. Sorry. Broadly, social inclusion is about addressing stigma and ensuring human rights. So this is moving way beyond autism awareness and really thinking about autism acceptance and not just as a concept, but really thinking about autism as an aspect of diversity and making sure that that autistic people are not disadvantaged because of prejudice and bias. And that there are opportunities for people with autism really to flourish in Canadian society. There are major issues of physical and emotional safety. I think we're cognizant of issues of bullying in children and youth, but certainly these are also major issues for adults that exclude them from post-secondary education, from the workplace, and lead to unsafe experiences in broader society. And again, there are certainly aspects of identity that in combination with autistic identity sort of put people at even higher risk. So for example, people from the LGBTQ community, and there's also of course a group of individuals who are both autistic but also parents and who face kind of a double stigma as they try to navigate society for themselves, but also advocate for their autistic children. Social inclusion also extends to enhancing community participation and accessibility, and also thinking about sort of emerging approaches, including technology-supported approaches to ensure social inclusion. And that of course includes broad availability to augmentative and alternative communication systems. And then the key findings sort of broadly address those issues, including some very specific recommendations drawn from the research literature as well as from other policy documents. Diagnosis, supports, and services. So speaking at the Glenrose and knowing that there are leaders from the service delivery community here, I mean, these are issues that we grapple with every day. There's a broad theme of equitable access. So separate from what the evidence-based models are, I think the reality of longer and longer wait lists and disparity in access in terms of where people live in the country, what their heritage is, and sort of their ethnicity and race. Certainly people living in Indigenous communities who are also experiencing significant disparities in access to basic assessment and treatment services. And then their issue across the lifespan. And we're certainly painfully aware of the disparities in terms of what's available when people are under 18, sort of despite how strained the system is, and sort of what's available to adults. And that's true even in the Glenrose, where we're fortunate to have I think potentially the only multidisciplinary funded adult diagnostic system, and yet it doesn't come close to addressing the needs of the community. So adopting that lifespan support, really acknowledging that although we don't have as much infrastructure or data, that there's no reason to think that that autism is any less common among adults than it is among children. Focusing on an individual and family-centered approach, kind of grappling with issues of what the evidence-based models are at different stages of lifespan, including during the preschool years. Really highlighting sort of what's known about available supports and services for school-age children and adolescents, and then addressing the needs for support and services for adults. But again, sort of framing this, that these are not intended to be interventions to make people less autistic, but rather supports and services that create opportunities. And as part of this discussion around supports and services, acknowledging the experience of camouflaging that many autistic adults talk about, which is actually in some respects sort of a negative effect of service approaches that encourage people to suppress their autistic symptoms or or adopt a communication style that may not actually be sort of compatible sort of with their way of being. Oh, sorry. So, and the report does include specific strategies that address workforce capacity and diversity. I mean, some of the things are things that we're working on locally. So how do we shift from a one-size-fits-all approach to diagnosis, engage with community partners, including sort of clinicians in the community, like in community pediatric practices? How do we create sort of a more stepped system of care where rather than one size fits all, we really take account of individual needs and complexity of needs, both in diagnosis as well as in service provision? And broadly, how do we address the fact that the diversity of the workforce doesn't really reflect the diversity of the clientele? And how do we really prioritize education and training, not just to sensitize service providers to these issues, but actually to kind of increase diversity among service providers, sort of through kind of prioritizing bringing in a more diverse workforce. Certainly, as we've gone through the pandemic, acknowledging that there have been some lessons in terms of what we can do virtually, both through telehealth and through kind of virtual methods that allow autistic individuals and families to participate in these types of assessments, as well as service provision from their homes, and sort of what some of the limitations are, but how that potentially opens doors in terms of access, and broadly a strengths-based, family-centered, and child-led approach across settings. And again, the literature actually is helpful that way in terms of reconciling some of the polarized discussion around early intervention, and in particular the modern forms of early supports and services that adopt a naturalistic developmental behavioral framework that involve behavioral instructional techniques, but that might be applied universally. So to the whole notion of motivation and engagement and reinforcement, which certainly isn't exclusive to traditional forms of ABA like discrete trials, but rather sort of are really strategies that are universally applied as effective teaching, but really thinking about sort of what are important functional skills that create opportunities for social engagement, participation, and long-term kind of opportunities to thrive. And then economic inclusion extends to issues related to financial stability, post-secondary education, pathways to employment, as well as autism inclusive housing options. And I just want to acknowledge that David Nicholas, many of you know, a wonderful professor in the Faculty of Social Work at University of Calgary. We're fortunate that David is based in Edmonton, and David was actually the lead of this work group. And his co-chair was an autistic man from Newfoundland, really quite an amazingly accomplished individual who has an executive role with Special Olympics and is also an accomplished athlete himself. So some of the specific issues that were discussed within the report are the importance of ensuring that existing federal tax benefits, including the Registered Disability Benefit Plan, are more accessible and easier to navigate. And also acknowledging that there are many autistic individuals as well as family members that experience substantial costs towards accomplishing goals that really should be publicly funded. So, not only paying for private assessments and direct services, but things like modifying the home environment to be a sort of an appropriate space as an autistic family member kind of continues to be part of that family through adulthood, access to appropriate accommodations, augmentative communication, mental health supports. So broadly, really thinking about the extra costs that are really sort of that really should be part of kind of universal public supports. The issues around post-secondary, including opportunities for early work experience, access to mentoring, including peer mentoring, and also really thinking about treating autism as an aspect of diversity within that within the post-secondary space, and really drawing on autistic leadership to make sure that that happens. Lots of information about accommodations within housing, really thinking about sort of the sensory environment, and other aspects of the actual construction of housing, and then also thinking about where housing is situated within communities to facilitate access to recreation, mental health supports, and so on. And then thinking about the workplace, and again, really sort of both that combination of thinking about what can be done to support the individual, but also autism as a facet of as diversity, and making sure that autistic people are having the opportunity to contribute their skills without facing discrimination and stigma, and that accommodations are available to them, for instance, around the sensory environment. And then there was a final chapter that really was about positioning the findings to have to really have the most impact ultimately, and just acknowledging that this, no matter how well constructed any report is, if it just sits on a shelf or it's just referred to sort of at one point in sort of planning the future, it's not really going to be very effective. So given that the report is grounded on evidence, recognizing that national data is going to be important to continue to inform our strategies, and not just national strategy, but just overall service planning and sort of how we approach things as individuals. We have some data within Canada, but it's really limited to children and youth, and it's largely about counting the number of people who have the diagnosis, and really thinking about expanding that data collection to more substantial issues about experiences in the service system, broader range of needs, and ensuring that that data collection extends to adulthood. And there are mechanisms to do that, even through kind of national surveys. Clearly, we need not only more research, but autistic-led research, and more broadly, there needs to be sort of a more substantive collaboration between people with lived experience, people from the research and professional communities, and also policymakers, and also really thinking about the unique contributions of autistic people who bring sort of an academic and professional background to their perspective, and also creating opportunities for pathways to those sorts of careers for autistic people. Ultimately, this is going to be an ongoing effort that requires sort of co-leadership, dialogue, but also kind of co-leadership in terms of kind of actual action towards these various areas. So that kind of covers sort of the formal part of the presentation. I might take a moment to invite both Grant and David just to kind of share their comments as members of the leadership group, and then looking forward to opening this up for discussion. So thanks everyone for their interest. I'm going to stop sharing, and Lori, thanks if you could help monitor the people's hands, but I will just give Grant and David an opportunity to weigh in. I'm just looking. Grant, do you want to go first? I'm just looking if your video is on. Sorry, there we go. Thanks.
Yeah, for sure. Thanks, Lonnie. Yeah, it was definitely an honor and a privilege to be able to be a part of the group that was really trying to explore what autism really means within all Indigenous communities. But I'm a firm believer in that I can't really speak on each community, right? Like, I'm not Inuit, I'm not Métis. I grew up in a First Nations community, but I really just try and represent myself. And what I see now of this report is that it should have been, led right from the very beginning by Indigenous peoples. But I don't blame people for not taking that approach, right? Because within Canada, within these colonial structures, what I've learned is that there's a lot of misinformation, lack of information. There are a lot of assumptions. And unfortunately, what this leads to is, okay, we can do it for them, right? And it's the exact same approach that I think a lot of people use within autism research. And don't get me wrong, this is a really great first step. And it really gave, I think, Lonnie and a lot of the other researchers some really great insights into what not to do and how do we move forward, right? And those are really powerful and important lessons, because as we try and move forward, and as we try and make sure that everybody is represented within this type of work, you got to be really mindful of how we're engaging, right? And for me, I'm really mindful that I'm just one person. I'm just one perspective, and I don't ever try and talk on other people's behalf. But with this work, there was a lot of guidance that came. And don't get me wrong, I wasn't the only person guiding this research. There was a team of us. And this team was very vocal about what we could do, what we can't do, being very critical about, timelines and relationships and things like that. So what I can see is that this is a great first step, but it's just a small first step, right? And so I'm really looking forward to the future work and how we can really collaborate in a really healthy way that really prioritizes relationships. Because if you're going to be doing this type of work, and that's the one piece of advice I'd give people, especially when they're doing policy work, you got to prioritize the relationships. And unfortunately, institutions like academia, it's very de-relational. And so just thinking about, you know, the work ahead, I'm really grateful that Lonnie was leading this, because he listens and he takes things, you know, seriously. It's never about, you know, power and control. It's about how do I do better? And I'm really grateful for him and the rest of the team. So I think as we move forward and as we try to get more people engaged, I think that we really need to think about those relationships. We really need to think about the people who really need it, right? Those children on reserves who have no services. Because if we're not getting to them, then we're just keeping the status quo, unfortunately. So thank you.
Great. Thanks so much, Grant, for sharing that, and for your kindness and for your many contributions. And I agree that this is barely a start, but at least hopefully it will sort of move us to that next step. Thank you. And David, anything you'd like to add before we open this up for discussion?
Sure. Well, thanks, Lonnie, for that really comprehensive presentation of a wide breadth of work, and Grant, for your comments. I think that are really insightful and important in moving forward. I too, you know, it was a huge task. And when you think of the diversity in autism, but also the diversity across the country, and I to come up with, you know, a large document, but a fulsome document with some really important considerations of the struggles in our communities, but also some kind of recommendations of considerations in moving forward, I think is really important. And I wonder if for us as a local community to do as we're doing today, really look at that and say, what does that mean in terms of beyond the idea of a national strategy? What are priorities to move forward well, and what are strengths in our own community, but also areas to push forward as we just really think deeply about some of these issues. And so Nathan, I'll stop there, but it was a privilege to be a part of this. And I agree with Grant's comments, Lonnie. Your leadership, as always, in this was just really impressive. And so thank you for being in that role. And I just personally feel like we're fortunate, because that leadership is certainly there nationally in your role, but also the fact that you're in Edmonton is just a sort of a wonderful gift to us as we seek to move this forward locally and provincially. So I'll stop there, and thanks for the opportunity to comment.
Well, thank you so much. You're both incredibly kind. And again, I want to acknowledge your leadership and wisdom. That you were such an incredible contributor to this process, David. And I've learned so much working with you and Grant, and really acknowledging there was an extensive leadership group that involved that included people with a range of backgrounds who really shaped this report. So anyway, and David, I really appreciate your framing of this discussion. So now what do we do as a community? So I see Sean, you have your hand up. Great, thanks for joining us. Please go ahead.